Can you look at a kid who's coughing, maybe a little muscle ache, and say, oh, that kid has the flu, and be 100% sure?
It's impossible to know. As I said, the symptoms, cough, fever, chills, runny nose, will be in varying degrees of severity in a patient. Some patients will have mild symptoms. Some patients will have severe symptoms. And those symptoms could be caused by influenza virus, but it could also be caused by other viruses or even other bacteria, depending on the individual.
New York City has set up conferences, has educated doctors, sent out emails, has done an excellent job of trying to get information out as quickly as possible. One of the things they're doing now is telling, at least explaining how you would make a diagnosis, and they were very careful about it. They mentioned a technique of using a certain type of swab technique in the nose, not a Q-tip, but a special device. Is that true?
It is true. Influenza virus can be identified accurately if a proper sample is taken. The proper way of taking a sample is using a type of applicator or sampling mechanism called a Calgus swab, which is a swab on a long, thin wire that's made of an artificial material that allows you to capture the particles of the virus without damaging the virus. The problem with using standard old-fashioned Q-tips is that the cotton tip of the Q-tip actually prevents you from accurately identifying the virus. So if you get an improper sample, you'll think that the sample tested negative, when in fact you still may be infected by the influenza virus.